or increased ease of breathing? What brings the increased ease of breathing? And presenting part passes downward and compresses the bladder. Turn the membranes out of the urinary frequency cervical myth in our where I come from, where they usually say that pregnant ladies wako na nguvu sana. A pregnant lady fighting, if they engage in a fight with a non-gravid one, that this pregnant yako na nguvu sana. Brief kidogo minor weight loss. Okay, thank you very much, Nick, for that evidence. Somebody has sent, Frida also has sent something. Premonitory signs of labor. I think tushapitia hizo. Tushapitia hizo. They're much more or less similar to what Nick shared. Similar. I read something here on spurious labor. Women experience contractions prior to onset. I think that's labor. Women experience contractions prior to onset. I think this spurious labor is evidence kuona kama kuna kitu mpya. I think there's something mpya here from Sally Shane, where signs until the baby is born. Duration premigravida 45 minutes to 1 hour. Born. Duration premigravida 45 minutes to 1 hour. As long as 2 hours. Multigravida half an hour, can be as little. Dilatation and gaping of the anus. Trick of blood. Outing and gaping of the anus. Gaping of the vulva in premigravida. The vulva of multiparous will gap even in premature pushing. Tenses between the annex and coccyx. Bulging of the perineum. Usually means delivery is imminent and visualization of presenting part. Confirmatory sign, no cervix felt on V. That's a confirmatory sign of second stage of labor. Then kuna physiology up of second stage. Thank you very much for that. Wanje pia ametuma kitu hapa, true labor and false labor, which tumepitia kule juu. Good. So now the question, we go back to our question and answer and then move ahead. We go back to our question and answer and move ahead. Ame, if you don't mind, kindly bring the question down. So, with regard to normal true labor, which statement is false? Can we get an answer there? Whether you're looking at a false statement, False statement. Two more cities. Thank you. Next question, Ame. So B says effacement and dilation of the cervix comes late during labor. So that's not correct. Okay. My sessions are usually very free. If you want to say something, kindly, please feel free to put up your hand. If we have seated and you later on realize primary postpartum infection is a recognized cause associated with uterine rupture. Usually, mchana tulipitia sana hii mambo when Jungle Boy was moderating. We went through at length. So I think we will just repeat the question and move ahead unless there is a concern from somebody. And it seems there's no contradiction. So yeah, some hemorrhage. Primary postpartum hemorrhage. But does it occur after 24 hours of delivery, yeah? Or within? Does it occur after or within 24 hours of delivery? So that statement, that's some panel beating. So how do we see it? Why did we go for D then? Can we get a rationale? Can we get a rationale why we went with that statement, with the D? And we agree. Joy anasema 556C. Then I give the mic. Kama will nani si Jungle Boy. Naona hii picha ni nisikia kuna
number B is not correct. The question is inauliza what is true, not what is not true. This what is true. So what is true is D. Hata ilikuwa kwa miles in the evidence in the afternoon session. And not B. B is not true. Primary postpartum hemorrhage occurs within the first 24 hours after birth. Thank you.
CTD. Okay. So it seems we are in agreement. Yes, Jeruto. Hi, how are you? Good to see you here. Shed some light. Nick and I want to answer Nick. Gonna say primary for the sake of clarity. Can we get something about primary and secondary PPH? Can we get something on primary and secondary PPH? This is Wesley has sent something on definition of postpartum exceeding 500 minutes soon after delivery up to the end of puerperium, 6 weeks to maximum 12 weeks. If it occurs within 24 hours, it's called primary PPH. But if it occurs after 24 hours of delivery and up to about 12 weeks, it's secondary. It's an obstetric of PPH, the difference between primary and secondary. Karo Nyamnyama ametuma pia kitu hapa. Nyamnyama anasema primary occurs within 24 hours after delivery. And then approximately 70% of immediate PPH causes are due to uterine atony. Atony of the uterus is defined as the failure of the uterus to contract adequately after delivery. Secondary of consumption in secondary. It's both. It's both. Evidence seems contradicting. So if we agree it's both, it's fine. If we need, we can get Miles. Ndio unajibiwa hapo Joy, causes za uterine atony ndio hizo unajibiwa hapo na Rainbow, distended bladder, full bladder of PPH 40 is torn atonic uterus, trauma pelvic hematoma. Na imepewa pia frequency. Unaweza uliza hiyo swali. So torn is 70%. We'll bring 70%, then followed closely by trauma. Worry about. Okay. Multiparous women are more likely to experience CTD. Kasam, ni CT na CTD. Yes, CTD, my CTs kwa sawa. Thank you for the CTs. Hamei, kindly, if I can get the next question, I will be a happy man. Ametuma kitu. Ya bali nafungua acha nione ya Jeruto. Primary PPH occurs within the first 24 hours after birth. And of immediate, and cases are due to atony. Tulikuwa tushapitia hii kitu I think tulikuwa tushapitia hii. It's more similar. Then secondary ni between 24 hours. Yeah, I think tulikuwa tushapitia hiyo. Question: is there a difference between uterine atony and hypotonic uterus? Double M is asking, is there a difference between uterine atony and Okay, can I proceed to question Sasa 557? Which statements are true of ideal feeding practices of newborn babies? Which state at least 3 hours after birth not be breastfed at all because chances of very high? Artificial formulas have no role where are not recommended due to increased incidence of allergy development. Which statements are true? Watu wanasema D is true. Contrary. Hebu mwangalie. Hiyo swali iko na jibu kweli? Nauliza 557 no answer. Watu wameweka D. Wacha nisome hiyo D. A last from I think this. Yeah, imekuja mahali at all. Yeah, imekuja mahali at all. At all. I don't think that's true. I think at all. I don't think that's true. I think if the mother is on heart or exclusive and have breastfeediwa. If the mother is on heart or exclusive and have breastfeediwa. Thank you, Cinnamon. Let me start with A. But because baby's GIT is still immature. Is that true? Is that true? No. Okay. Mwachie up. No. Mwache hapo, twende number 2. Those babies whose mothers are HIV positive should not be fed at all. No. Okay. Okay. Tuachie hapo, tuachie hapo. Twende C. Tuachie hapo, tuachie hapo. Twende C. Artificials have no role where a mother is not having adequate milk production. The mother is having adequate milk production. Is that statement true? Is that statement true? Breastfeeds, the more the let down recommended due to increased incidence of allergy development. Is that statement, is D true? Is D true? Thank you. Yes, thank you for Geruto for bringing the question down. False. You know, they are highly discouraged. They are in very, very selective cases. But I don't think milk mothers, adequate milk production is a reasonable answer. I think amekata. Cinnamon amekata kabisa. Cinnamon is my family friend. Akikata lazima nisikize yeye. So how can where all of us will be on the same page in isolated cases where amekata C is not correct. Ingekuwa family has no role. So mama kuja aseme, is that what we are saying? Sema, for the sake of baby case replace. Okay, can we get something? Can we get something especially on the indications of artificial formula? I think that will answer our question because it's the bone of contention. Yes, Jungle Boy. You're putting across a very important aspects. You're putting actually there is a code, I think, in law that bans ease of it to the artificial whatever, even selling them. It's a criminal, it's a high criminal offense. So I get what you're saying, Jungle Boy. But we have to come up with a collective response that works for all of us. We have to come up with a collective response that works for all of us. Just to be for the sake of all of us. You have a point, but remember here the question is telling you about milk production. The mother tells you milk production. Let me pose a question. What stimulates milk production? Let me pose a question. What stimulates milk production? Okay, let me rephrase the question. Does milk production that is not mama hajaza na ule mama mwingine maybe ukianza kunyonyesha mtoto, will you be able to produce milk or no? Ukichukua mtoto wa mtu, wengine wanasema sina mwana amekata hiyo si kabisa. Sasa mpenzi. Mpenzi ametokea mpenzi. Mpenzi ametokea. Okay. What do we do? Rambo, kindly please. Who is Rambo? I confused. So, kama mmeagree kwa we do Rambo, kindly please. Who is Rambo? I confused. So, kama mmeagree kwamba breastfeeding in artificial formulas have no role where a mother is not having adequate milk production. Mbona mnakataa hiyo jibu? Kama mnasema breastfeeding started within 3 hours or below, which can be immediately within an hour or any other time within 3 hours. My thoughts. Nasema feeding should start only. Take note of that word only after. Take note of that word only after at least 3 hours. At least 3 hours. So mtoto akizaliwa hivi usiekelee. So mtoto akizaliwa hivi usiekelee ungoje 3 hours early initiation of breastfeeding. Bonding, hiyo mambo ya uterus involution, all those. In fact, tunataka hata kangaroo or I allocate, since we are hitting a snag, can we get some Msemakweli? Rambo used to help the Msemakweli. I have not seen him here. Nanok also used to help with Msemakweli. And then who else? Maya also used to help. Nanok looks for evidence. No. Nani alikuwa nakubali hiyo mambo ya si. Mtupe something. The baby is suckling inefficiently. Parents are unable to quantify the amount of breast milk received by the baby. Some parents want to know exact measurement. Tupa C Okay, sema nasema rudi tena kwa si utaelewa mbona tunasema no. Cinnamon, can I give you the mic? Ndio unanifurahisha dai period. Ndio nimesema period. So net imekataa. Okay, so hakuna answer hiyo swali. Am I right to say that? Can we say that? Hakuna jibu. Okay. Sawa sawa. Hakuna jibu, tuendelee. Hakuna jibu. So, but Sabigal and Jungle Boy, please look into that question again. Your location still stands. No answer. Yeah, just we have not read the question. We have not read the question, but thanks for the attempts. Kindly, please, for subsequent question, let us read the question and then we get the response at once. Thank you for understanding. 558. Concerning obstetric examination of the fetus, presenting part could be the shoulder. Lie is longitudinal or transverse. 558. 558. 558. I see B's and C's. I see B and C's. I see B and C's. That's the reason why we even D's there. That's why we encourage that people wait till we have all options. Yeah, Cinnamon, thank you for explaining to Nji here something there. So all answers are there, all options are there. So inauliza, concerning obstetric examination, the following are true. Fundal height denotes the gestation of the fetus. Is that true? Is that true? True, true. I think we need an evidence. We need an evidence. So that one, iko na contradicting answers. Hame, kindly tuma swali hapa. Fundal height. So LMP. Is fundal height, how accurate is fundal height? How accurate is fundal height in estimate? Jeruto anasema fundal height dini wakati hiyo presenting part could be the, I think hapo hakuna is longitudinal or transverse. Yes, true. Lie can be longitudinal or transverse and oblique. Yes, thank you. Now we go to the fourth one. Fetal heart sound of 160 beats per minute is normal. Is that true? Hiyo mtu analia amekata. Somebody type 110 to 160. 110 to 160, 120 to 160. Frida, I'm giving you 30 seconds.
Hey.
Hi, Frida.
Hiyo ya heart sound ama ni mimi na overthink? It will be heart rate.
Okay. Yes, you have a very, you see, that's why we need to be very keen. Jungle Boy alisema, we need to be very keen, paying attention to details. You see what Frida has just identified? Frida has just, identified a very important point. Mambo ndio hiyo. Paying attention to details. Thank you very much, Frida. So we have can we get cities for that question? Question here, EDD, after and before 3 months. That's an important question. That's an important question from Beva. Can we get something on calculation of EDD? And took us through very well. Can we get somebody go through that? Thank you very much, Frida. Can we clap for Frida? Yes, thank you. Sawa Frida. Hiyo calculation of EDD. Calculation of EDD. Thank you very much. Anasema LMP plus 1 year. Guys. Nini. Nadine amekataa hii mambo. Fit sound na fetal heart rate. Hawakubaliani na sisi. Hiyo mambo ya sound. Nadine kwani watu wamekataa hiyo. Jeda is not available, so I think that has passed. Nanok, let's finish hii swala alafu tutaona hiyo evidence yako. So Elliot, okay.
On option C, is talking about lie being either longitudinal or transverse. We have another lie position yenye ni oblique. So C ina define lie as being longitudinal or transverse. So I pick C.
Mnaonaje hiyo argument ya Elliot? Mnaonaje? Nile anakubaliana na wewe? Melissa anakubali? Neo amekataa. No. Sorry, Hamei. Again, please move the question down. Sorry, Hamei. Jungle Boy. After Jungle Boy, I will allocate if we don't agree. Jungle Boy, go ahead. Jungle Boy. Yes, yeah, audible. Yeah.
Okay. The fetal heart sounds, you cannot be having sounds in beats per minute. You have the rate. Fetal heart rate in 5 beats per minute. The heart sounds should be galloping horse. That's the fetal heart sounds. Galloping horse and not beats per minute.
Thank you, Jungle Boy. Brenda anasema we are over. Mnaonaje hiyo argument ya mtu anataka kuongea tena huyu nani? Mr. Chacha, you want to say mtu anataka kuongea tena huyu nani? Mr. Chacha, you want to say something? Mr. Chacha?
I was saying kuwa they can never be beats. They can never be beats. So fetal heart rate, I mean they cannot be heart rate. So fetal heart rate, I mean they cannot be heart rate. Fetal heart rate or a wheeze or a stridor.
Yeah. Pause or squatting. So Harriet, this explanation of yours, is it endorsing that D or not? I think the heart rate is 110, 160, but 160 is a tachycardia. Longitudinal and transverse are indeed types of fetal lie. This state has an absolute definition because it omits the oblique lie. That is Msema kweli, yes. Providence. Msema kweli, yes. Providence. Can we get Msema kweli? Msema kweli? So Nadina anasema is the same thing. Fetal hearts and anterior presentation. 20 chest rises per minute or breaths per minute. Okay. Mwangalia yako tena vizuri. Wacha niangalie Okay. Mwangalia yako tena vizuri. Wacha niangalie iko mbali. Swali iko mbali. Iko mbali. Swali iko mbali. The gestation of the fetus. Mwangalia hiyo swali. Charts ni mingi. I'll allocate to who? Let me read this evidence here. Clinically assessing, hii ni joy. Clinically assessing the uterine results, although hii ni miles. No, not answer. Clinically assessing the uterine size to compare with the gestation does not always produce an accurate results. Not correct. Wanauliza which California CT is Nanoka nakata is not true. So that's why hiyo inasema not true. Umeona hiyo evidence Jerutra na Den. Tuendelee. So we have two people to give us to give something at the end of the session. Some of these questions venye ziko structured naona kama ziko na issues kiasi. Yes, that's true. They have issues. Sijui zilitoka wapi hizi swali. No, sometimes the Kathy is missing. Kathy is missing somebody to check on Kathy. Cinnamon, please, you need to check on Kathy. People are concerned. Yeah. Should be present. Cinnamon, you had given. Okay. We had some assignment on the from Med Scholar answered it. The following are good feeding practices for a newborn. The child should be fed at least every 3 hours. Feeding should start at the earliest opportunity after birth. Exclusive breastfeeding is preferred for all mothers, even if they are HIV positive. During breastfeeding, a mother should achieve good positioning and attachment of the baby to reduce exhaustion and ensure adequate. Can we get that question? Ilikuwa question gani? Tuone hiyo di answer na Noka amefanya assignment. Inasema allowing the mambo because tunataka mama huyu aende jungle na sabi. The learned fellows here wanasema hapana. Wanasema nikisitia hiyo swell they will crucify me. Aha. I got something to deal with. Can I get somebody to Okay, thank you, Jungle Boy. Thank you, Jungle Boy. I'll be back shortly.
Question number 5. There is no answer in those questions. If we read through the questions, the answers of that question is that there is no answer. Infant feeding guidelines are incorrect. Number 557. All the statements that are there. Na hapo iko sawa? Kama bado niongeze hii nimefanya kuangalia this product in 557. So 557 tumanishia hiyo screenshot. Wacha ni share some of them. Okay, I'll screenshot that information I will share. Maswali, ngoja swali hapa. Okay, or even the Kenya National Guide Obstetrics care. In the muscle tissue developed is the ectoderm, endoderm. So to that question is direct from embryology. Okay, you just discuss the rest. What arises from the endoderm and what arises from the one. Meanwhile, that question also. You get all the rest. And thank you for your cities. This has been shared by Professor Mawaki. To the formation of some organs. Allow me not to read much today. Hii hapo tu direct inakuwa kwa miles on what happens after which. If in case you don't get it here, anatomy and physiology, someone can, kama kuna mtu kuna textbook of embryology can share so that people can get it here. An evidence from the reproductive system. Done. Tumeelewana hapo. Magda, I think refresh. Motoka alafu rudi. Next question on 560. To palpate the lower pole of the uterus above the symphysis, pubis to determine descent of the fetal head. Locate the fetal back in order to determine the position that tuanguke nayo. That question is also direct, very direct. Very direct, very direct. Naona tunasema kuna bado A na bado kuna D. A, D, A, D, A, D. Oh, this is purpose to determine the distance. It says judge the size, flexion, and mobility of the fetal head. As someone shares an evidence, nikingoja watu watume evidence, let me just read. The fundal grip identifies the presenting part. Naona kuna evidence inaingia. Well, I even don't need to strain it. Or first, or breathe. Those are the findings. In short, it identifies the presenting part. That's the fetal pole in the fundus. The grip number 2 is the lateral grip, and it surveys that's back. If you feel, and its purpose and mobility of presenting part above the pelvic inlet. Then the pelvic grip, the fetal attitude, and the descent. That's quite direct. So to situate what the one, we don't need to 5. Nasema CT deep. It's deep. So reciprocal nime CT deep. Read D. Nisoli kwa wapi? Yeah, D nasema judge size, flexion, and mobility of the fetal head. That's the work of Pollock's grip. Hi. Asante for the reminder today. No, siko nimeangalia juu but nimeconfirm. I think I have explained all the 4 grips. I have explained to you before. Yeah. I think I'm the first. That's from the manual that you use in your facilities. So I don't think kunaweza kuwa na contradiction hapa. No. Sawa vizuri. The Lord clinical manual. Note out. Next question Ami. Na mujibu maswali. Naona mmoja ameuliza when examining about the sawa. Sabigari ametumanisha ya procedure manual vile iko. Some of the size, flexion, and mobility of the head, but such evidence to support one method over the other. Polyp maneuver is where the practitioner grabs the lower pole of the uterus between the fingers and thumb, which will be spread wide enough apart to accommodate the size. Niteremshie swali lingine. Complete relaxation of the lower uterine segment, inclusion of the cervical canal into the lower uterine segment, process of enlargement of merging the upper and the lower uterine segment. B. Here, Milo, that the evidence shared by Emma on next question. and then respond to your friend's answer, and then respond to your friend's answers. Question, sorry, and then respond to your friend's answers. Question, sorry. If you get what they're asking, just the presenting part that what they're asking, just the presenting part that has sunk into the lower uterine segment, the largest diameter of the fetus valve that has passed through the pelvic brim, and on which the can have to from miles directly. An evidence from miles. An evidence from miles. Number ya work. It is well. Everybody saying C. C inasemaje? Everybody saying C. C inasemaje? Oh, oh. Ndio inasema engagement is said to have the pelvis in cephalic presentation. That's engagement. This is the context. Is the context. You can't tell me you're looking for an evidence from my sentiments and the previous question. Now here question is on the same page. Yawanga, presentation refers to the part of the fetus that lie at the pelvis rim. Yes. An evidence from Linda Wanga. Ni watu wengine ama I can't go outside your evidence. I can't go outside your evidence. Go miles, I know you. Tubulosome. Presentation. Okay. Relationship of fetal limbs and head to its trunk. Representation is part of the fetus that lies at the pelvic between. Representation is part of the fetus that lies at the pelvic between the long axis of the fetus and the long axis. Thank you very much, Blossom. Thank you, Nok. Nok pyramid to the part of the fetus. This is the part of the fetus that is over the pelvic inlet. This is the part of the fetus that is over the pelvic inlet or the cervical os, and that's option C. Yeah? Option B is engagement. This occurs when the bifurcated refers to the posterior or the cervical os, and that's option C. Yeah? Option B is engagement. This occurs when the bifurcated refers to the posterior of the joints in relation to fit the joints in relation to fetal parts to one another. The normal fetal attitude when labor begins is with all joints in flexion. and the lie refers to the longitudinal axis of the fetus to that of the uterus. Referral says much. See, to CT usually. To CT usually. Sabijari ametuma engagement, so pia kuna salishen ametuma, so pia kuna salishen ametuma presentation. Thank you very much. From Miles exactly. From Miles. From Miles exactly. From Miles. So then kama kuna contradiction hapa. Sawa. First here. Ministry of Prosperity. Ministry of Prosperity and Secretary. Follicular, luteal, and ovulation. 563. There's one thing I should ask here. Tumesema si. Now, tukisema si unajua ijapangwa in the correct order. Those are question marks into the group. Question marks into the group. Okay, those all the three faces in. Tutasema aje? It has all the three faces that are present. Tutasema aje? It has all the three faces that are present. Okay. So hawajasema in order. Thank you very much. So see that question. Hawajasema in order. Thank you very much. So see that question. Sit to talk up. Acha nitaka kusikia makelele. I have parents who like fun. Okay. Watu mmezoea ikiwa no answer. No, hatujazoea ikiwa no answer. I wanted to see if people were keen. 564 reads the fetal causes of intrauterine growth retardation include HIV/AIDS, multiple gestation, genetic disorders, fetal infections. C. Maternal diabetes, fetal distress, placenta previa. And then D. Syphilis, radiation, MSS gravidarum. Tukumbuke na nimeenda Kenya. Napenda kukaa sitting room nikimoderate because of I like some comfort there. Nikienda kwa Kenya inakaa tunafukuza na nyumba ni yao. I don't own it. Alright. Niko na Simba bana. Hata nimeenda huko. Naona 564 B. What does B say? B says multiple gestation, genetic disorders, and fetal infections. Some small evidence on this. Some small evidence on this. For this one. Very fast. Some small evidence for 564. Evidence in Google. Ama ni CTB tu. Alafu Manu, if you're present, you can raise your hand. Ulikuwa umesema 10 minutes. Naona it is almost 30. Shit. Dictator amesema hii maswali imerudiwa. So to CT tu juu imerudiwa ama? The problem I have realized with us is that right now we are 200. Imenifurahisha sana. Tafadhali evidence. Hey guys, let's not. Oh, what is this? Sabigal, thank you for forwarding this evidence. So there are two. We have maternal causes and fetal causes of IUGR. In maternal causes, we have constitutional, that's small women, maternal genetic and racial background, not at increased risk, and pre-pregnancy weight less than 1,000 pounds. That's twofold rise. Reduced intrauterine growth of the mother is a risk factor. Maternal nutrition, social deprivation, maternal stress, toxins, and then you have antiphospholipid. Under fetal, you have structural anomalies like those of cardiovascular and renal systems. You have chromosome abnormalities, 12%. Then you have disorders of the bone and cartilage. You have infections, that's the torch infection. The mtu anaweza type torch in food, multiple pregnancy, and then chronic hypoxia. So the members of this group, especially the new ones, and the old ones are CT, torch toxoplasmosis. Then we have what else? We have cytomegalovirus, we have rubella, we have H for hepatitis. Nimesema ni gluconate, torch in full ni toxopla. Manu, on board please.
Thank you, Jungle Boy. Umefanya jambo la busara. Jungle Boy had conclusively covered that, so we can get the next question and proceed. Thank you very much, Hamay. 565 newborn lungs helps to provide stimulation to the respiratory kidney of the newborn, and they increase the surface tension and allow expansion of the lungs. All of you have attempted the question. I'm skimming through one. Akuna. B says reduce surface tension and allow expansion of the lungs. Where is surfactant produced? Type 2 pneumocytes, cinnamon. Amejibu. Climax type 2 pneumocytes. Okay. Kulikuwa na mambo ile ya RDS, respiratory distress syndrome na asphyxia. I think it correlated something on that. And what drugs do we administer kwa mambo ya ni preacher mama ni gani? Zaitwaje hizo dawa za kusaidia hii mambo ya what group? Tocolytics. Thank you, my deski Caro. Tocolytics. Thank you very much. What's the difference between RDS, respiratory distress, and asphyxia? The difference of the village vibes. Surfactant inatolewa kwa type 2 pneumocytes. That's why it's produced. Climax asphyxia, inability to initiate breathing. J chacha asphyxia, lack of oxygen. Huyu jamaa who minds me written tupitie hizo 3 conditions quickly. Time is far much gone. I think we have encountered these questions several times, as much as I can remember. We have encountered these questions. Tocolytics is a knock off labor. Aro, take note of that. Tocolytics. Hizi zinaitwaje? Hizi zingine zinaitwaje? Tocolytics nasikia ni za knock off labor. Can we get something on these conditions? We run through quickly mtu mwenye conditions and move ahead in having understood something. hope mtu asphyxia, baby fails to breathe. Sabigal in neonatal culture. Anybody who knows? Before I continue reading. Hyaline membrane what? Disease. Hyaline membrane disease, okay. In the airways resulting from the damaged epithelium. RDS refers to the clinical disease process. The disease occurs as a result of the insufficient production of surfactants and is seen most frequently after premature birth. However, other disorders such as maternal diabetes or meconium aspiration syndrome can also inhibit surfactant RDS. And then kuna some statistics there. Surfactant is produced by type 2 epithelial cells, 2 pneumocytes, to reduce the surface tension within the alveoli, preventing their collapse at the end of exhalation. Collapsed alveoli requires, we got what we needed. Can we get something on asphyxia? I think we have got something on RDS. Can we get something on asphyxia? Thank you. Who is this? San, also you've sent evidence. I think it's similar to what then kuna CS, prenatal asphyxia. CS, take note that point, due to lack of stressful delivery. No. Due to so vaginal go for vaginal delivery. Siende mambo elective. Jerop Joan has sent something on asphyxia neonatal. Of asphyxia. The degree of asphyxia is determined by the APGAR scoring. Kuna hiyo APGAR scoring iko hapo. Tulipitia hata leo. So I think tumeona what asphyxia is. Baby fails to breathe, na tumeona RDS, na tumeona some of the risk factors or conditions that can cause CS delivery being one of the contributors. Okay. Thank you very much. Can I get CT for that question? Can I get CT at least roughly? We have gone through and ametuma tena cherop, mild asphyxia 6 to 7, moderate 4 to 5, severe 0 to 3. Hamei, you have been very timely in sending questions, and with the many chats you have been bringing it down. Thank you very much for that dedication. You're really making the discussion seamless. Lumbar vertebra and characterized by a small dimple. The defect is likely to be maneno ndio hii sasa. Hapa lazima tupitie hizi spina bifida zote. Watu washaenda na B. Mnangoja kidogo. Meningocele, meningomyelocele. Types of spina bifidas. Types of spina bifidas. In the meantime, somebody to bring cystica and occurs. Normal spine. The neural tube closes at 3rd and 4th week gestation. Okay, let me start with spina bifida. Bifida is a general term for a birth defect typically diagnosed during pregnancy, where the spinal column fails to close. Spina bifida means split spine. Development, drugs, malnutrition, chemicals, genetics, folic acid deficiency, vitamin B9, and diabetes, obesity. Spina bifida occulta. Defect of the vertebral body without protrusion of spinal cord, hair, or discoloration near the spine does not need immediate medical care if asymptomatic. If symptomatic are present, the client will get an MRI. Then kuna meninge, the defect in the vertebra, usually minor or meningocele. Protrusion of the meninges, CSF, and spine. Hizo ni mbaya zaidi. CSF iko, spine pia imetoka. Then skin may be exposed as well. So the spinal cord often ends at the point of the disc. Bladder bowel incontinence, neurogenic bladder, meningitis, hypoxia, and all that. So at least we are aware. And then, okay, Yufi has also sent something similar to that. Welcome. We have not seen you for a while. Welcome to join us again. Okay, let me get it for that question. All right. More or less what we have read. So in the interest of time, we have grasped something quickly and we can proceed. We have, but there were another question. You can pay 5 minutes. There were people in Mesao. This is still spinal bifida tumeona. So we CT. Let's CT. Thank you, Reese. Thank you, Reese, for this. Ametuma some pictorial. Cherry malformation. What is that? Steps anauliza. Steps. Malleus, incus, and step. Is steps there in the body, ama? Ama ni gani? Yes. So steps, you are our last born here. Ama ni incus. Sharon, question? Thank you, Hamei. 67. Partograph is started in labor when? Partograph is started in labor when a cervical os is 2 centimeters and above dilated. The contractions are moderate to severe. 567. 567. Watu wameenda na 7 no answer. Tuko swali gani? Naona 568 somewhere. So kuna B. Chacha anasema no answer. Big Fish anasema updates ni 5 centimeter. 567 no answer. We exact order. Just perusing through kuona kama kuna Jungle Boy ametuma kitu hapo. WHO Labor Care Guide ametuma. Sema B nasema cervical os is 4 centimeter and above dilated, ndio unaanza partograph. But saa hizi tuna update. So wakiweka 4 hapo tutaweka 5. Are we in agreement? Kwamba tutaenda na 5. Msiende no answer, go with what is present, but kwa mind you know the exactly Klimek. Exactly Klimek. Dragon day. Klimek. I've not seen Dragon today. I don't know what's up with Dragon. We are our brother's keeper. Okay. Kama amekuwa na sisi. Of combined oral C eugenon and nodettes, D nodettes and microvalve. Hii ni kama fununu kwangu. Hii ni kama fununu. Watu wameenda na C. Hata Dragon anajua hii bwana. Hii nilishindwa kujua hii bwana. Hii nilishindwa kucheka. Hizo brands vile sijui pia mimi. Questions look familiar. C inasema mtu anashikaje hii kitu? C inasema mtu anashikaje hii kitu? Eugenon na nodet. Eugenon na nodet. Unashikaje hii? Unashikaje hii? We shouldn't. Oh, just similar. Okay. Kama ni similar ni sawa. It means that it's a common question. So, but I think we need to know mambo ya COCs. Ingekuwa sawa. I like covering a little bit broader to understand it, because najua most of us after this discussion hatuwezi kusoma. But I think with time, if anybody has a simple way of tunaweza shika hii swali, then atupatie. But I want to give Nadine and Jeruto a chance to give us the response for that question so that we close it. Nadine, I don't want to eat into units. Yenye Nadine na Jeruto walikuwa tufanye, and then we give them a chance. Yes, Salishin ameshatuma mambo ya COCs hapa. You know, it's a combination that we know, progesterone and estrogen we know. Then pills, they come 21 or they act by inhibiting ovulation and thickening cervical mucus. Thus, the provided pill comes into 3 types. Monophasic. Each active pill contains the same amount of estrogen and progesterone. Examples are microgynon, lofeminal, nodette, and mavelon. Then kuna biphasic. The active pills in the packet contain 2 different dose combination of estrogen and progesterone. For example, a cycle of 21 active pills, very helpful. Then kuna COCs hapo, the same thing. Clock kanatuma. Clock ndio asgrab ama ndio painkiller. Now, mulisema hizi dilations zikikuja 5 cm, 4 cm, na 6 cm, which? Baba Nadine, which question are you asking? Which question are you referring to? 5 according to new updates. Kitambo ilikuwa 4 5 Baba Nadine. 1 minute into the time. Hamei, hiyo swali ya Jeruto na Nadine iko wapi? One keeping us Nadine. Nadine and Jeruto. I see Jeruto is typing. And Nadine is sending time. Yes, swali ndio hiyo. Concerning obstetric examination, the following are true. Move on. Otherwise, we can push this swali to the next. Nadine ndio amefanya assignment. Abdominal examination in pregnancy palpation. Fundal height. Symphysis, fundal height. Fetal pulse, fetal lie, presentation. 558, I go with B. Presenting part could be the shoulder. Concerning obstetric examination, the following are true, except in cephalic presentation. What is the presenting part? I think Nadine has a point. In cephalic presentation, what vertex occiput is the presenting part. Okay. So in shoulder presentation, what will be the presenting part? Acromion. Done. Assignment. Very well. Do you agree with me? Do you agree with me that Nadine has done her assignment perfectly well or no? Yes. Yes. Making your dad here very proud. Passion. We are many now, and it's a bit too hard to control the group. But I think we've had a similar session. Let's clap for Nadine, please. Let's clap for Nadine. Let's clap for Nadine. And Hamei, you have been very, very excellent and on time. And you've been sending even questions. I think it has been a very, very I really enjoyed mod.